first. Good morning, everybody. I just want to apologize for not being there in person. I would have really appreciated being able to be there to share all of this with all of you. But unfortunately, things just happen, and I ended up not being able to travel up. So I'll just start by introducing myself. My name is Rachel Olson. I am a citizen of the Tr'ondëk Hwëch'in First Nation. Um, I was born in Whitehorse. My family's from Dawson, and I currently live in North Vancouver on the Tsleil-Waututh Reserve. So that's where I'm speaking to you from this morning. So our project was enhancing access for Tr'ondëk Hwëch'in citizens to supports and services. And really the focus of our work was very similar to actually the previous presentation. So I was slightly panicking through that presentation going, oh, I think we might be saying the same things, which, isn't necessarily a bad thing. I think, the more voices bringing forward the strengths and challenges of the work that we undertook, the better. And so I will just wait and see if Ali can get the presentation on the screen.
Ooh.
Can you not?
Okay.
It's also in the Google Drive, but I won't screw things up by suggesting that right now.
All right, I think.
Oh. Great. Okay. No panic. It's fine.
Does anyone know how to make it not show that?
No, it looks good right now.
Does it look okay when I do that?
Yeah, it looks great. Mm-hmm.
Oh.
Okay, great. So we can just go to slide 2. Thank you so much, and I apologize for the technical delay. So Ali and I are both from the Firelight Group. I'm one of the directors, co-owners, and founders of the organization. We are Indigenous owned, so we are actually owned by 3 First Nation individuals, myself, and 2 other directors. We were founded in 2009, and we do a range of Indigenous communities and organizations. Our founding principles are relationships, accountability, and quality. One of the interesting, well, I think it's interesting, but that's because I'm part of it. One of the interesting parts of Firelight is that we work almost exclusively for First Nation communities, and we're often working within the context of environmental impact assessment. So I think what really makes Firelight interesting is the community-driven, community-led work that we do. Really, our clients are the nations we work for. They're our bosses, and we are beholden to the work that we do for them and answer to their questions and requests. So it's really turning sort of that research, that extractive research model on its head, in that we're there in a capacity to serve our clients rather than coming in from a different institution that isn't related to the nation's governing structure to do the work. So that's us. Oh, and I guess, sorry, before I move on, I'm going to let Ali introduce herself as well. Thank you.
Thanks so much for having us today. I'm Ali Tachenko. I'm a researcher with the Firelight Group. I don't work in IT, clearly. I'm calling in from Victoria, BC, on the traditional territories of the Songhees and Esquimalt nations. I helped support this research sort of through the writing process, and it was really fantastic to hear all of the community voices. I'm so glad that we get to share our findings with you all today. Thanks so much.
Awesome. Thanks, Ali. So the next slide. So really just, I'll just tell the story of this project. So really the beginning, Tr'ondëk Hwëch'in got in contact with me and asked me if I would be willing to lead this research project and apply for this funding with them in order to do some research. And they really left it wide open to sort of the topic or the angle that we wanted to bring to the table. And so after, some collaborating with other people and Yukon researchers, we kind of settled on the notion of access to healthcare services, and in particular mental health services during COVID. I will say that, something interesting about this research is that we mentioned that it started in November 2020, which is very much still in, right in the middle of COVID and dealing with all of the issues. And I think that was something that was interesting, like good for the Yukon for getting ahead of things, but the ability to meaningfully engage and undertake this work during that time period was a big challenge. People, as you'll find that we talked to, the challenges of burnout and being overwhelmed by the issues that were faced every day in terms of managing the pandemic and what that looked like for the nation, government, employees, as well as just everybody, I guess, in the world, that maybe the research wasn't at their top of their priority list. And so, something that we thought would take about 6 months actually took 2 years, which, I'm very, very grateful that the Yukon government was so flexible with that funding arrangement and recognized that flexibility needed to happen in order to do this work in a good way. Great, we can go to the next slide. So our study really, we really looked at 3 different sort of levels, I would say, of engagement and types of research that we encountered. We also did, a very sort of classical literature review, a scan of current services and service delivery within Dawson City in particular, but also, a little bit at the territorial level, but not as thoroughly. And then we did, direct engagement with community members, with citizens, with service delivery providers. And then also we wanted to capture sort of a more systems level, higher level of approach, which, meant ongoing engagement with TH leadership, as well as exploring questions of governance and jurisdiction throughout the research process. So we wanted to try and sort of have that sort of broad range of views in terms of what does this actually look like and what was happening on the ground. Great. And so we did we did a community survey. We started off, and I guess this is a nice example of what it means to really be community-based and community-driven. We started off we're like, let's do it online. And then, when you have a survey open for a while and only 2 people responding to it, you're kind of like, okay, we need to actually shift how this is happening. And so when we did go to Dawson to conduct the research, we had shifted from an online survey to in-person surveys with TH citizens, as well as phone interviews. And we hired a TH citizen to support that process of rolling out the community surveys. And it was really interesting because, 5-minute warning. Okay. Sorry, I got a sign. It was interesting. We had a quite comprehensive long survey, and as soon as our TH community researcher looked at it, they were like, nobody wants to spend this much time answering these questions. We have to condense it and make it actually, palatable for people to want to talk to us about these things. So we went through another survey revision in order to really condense and simplify the questions that we were asking in order to increase the engagement of the community within the research project. Okay. Thanks, Allie. So the main areas of questions: impacts of the pandemic on key mental wellness and health services, on the impacts on the mental health and wellness of TH citizens, challenges and also the importance of cultural programming. So really following that, having culture as the base for health and wellness, and then building out from there. You can go to the next slide. So what we heard, so I think we did sort of pull out the effects on youth, but I think that it was a little bit more broad ranging than that in terms of what we heard. I think um, you won't be surprised by the fact that people felt very isolated, and that the impacts to mental health um, showed themselves in a number of ways in terms of social isolation, the inability to see and support loved ones, increase in substance abuse and return to substance use, was all noted by people during our interviews. And the social isolation really appeared to contribute to all of these things. Um, Also, there was an inability to access services in the same way that was before the pandemic, and then the ability to sort of shift to a more online model or online way of doing things was really a big challenge for people. And we saw from our interviews with the service providers that there was a lot of quick thinking happening in terms of how to adapt and adjust the service delivery in order to better address the needs of the community throughout the pandemic. But that didn't, that also came with its challenges as well. We can go to the next slide. So what we heard was really, it was interesting because when we talked to mental health professionals in the community that were providing services, they didn't really see an increase in uptake in new patients coming or new clients coming to access their services, but there was an increase in their demand from services from existing clients. So there wasn't, I think there's probably a hesitancy to access services if you hadn't accessed them already. And so understanding those pathways within a COVID pandemic environment to accessing the services within the community was a challenge. Also, something that came through really strongly was how Tr'ondëk Hwëch'in was really a leader in the community in terms of um, setting out protocols and policies, and people were really looking to Tr'ondëk Hwëch'in for their guidance in terms of how to adjust their programs, how to stay within COVID protocols. And that includes, non-TH services and delivery programs as well. And so, we wanted to really make sure that we recognized that leadership of TH and how responsive they were. It was really interesting. One local NGO said that their advice from the territorial government was to contact Tr'ondëk Hwëch'in in order to access PPE and different things. So even the messaging from the territorial government was to contact the local First Nation to get access to appropriate things. So that comes with a whole bunch of interesting questions. But I only have 2 minutes left. So another thing that the citizens communicated to us that was really important was the importance of having a really strong communication strategy, especially for elders in the community. Everyone talked about the importance of just picking up the phone and having that clear communication pathway to make it feel like that people cared about them, and that there was going to be that communication. However, the ebbs and flows of staff burnout meant that communication wasn't always consistent throughout the pandemic. And so I think for future planning, just making sure that there's plans in place so that there is consistency within those communication protocols, and opportunities to connect. Another piece was food delivery programs, so taking care of people's physical health. Their diet was really, really important. TH really stepped up in terms of a food delivery program. People were very grateful, and it was really became one of the only, not one of the only, but one of the main ways that TH was able to go out and support those community members. And it was really felt and appreciated by everyone. And also just, the appreciation for community nurses providing vaccination services, that there was a sense of people pulling together and doing things well. I would say that just quickly, another couple of interesting things was more to do with the larger infrastructure and how buildings and architecture and how things are currently set up in terms of whether or not you can facilitate um, clients and delivering services within a pandemic environment. And that thought now is being given to setting up spaces so that they are, kind of compliant within that pandemic social distancing environment, so that we won't see the same disruption of services as we did at the beginning of COVID-19. For example, the women's shelter and the men's shelter, both, are currently quite small spaces, and so there was really big changes to how those physical spaces could be accessed by clients, accessed by citizens and people in Dawson City in general. And that there was also, some resistance um, to some of those changes and a feeling of further isolation because of some of those protocols that were put in place. That also happened in terms of, elders wanting to visit and spend time within the administration offices or the community center. Again, during the pandemic, there was protocols and sign-in sheets, and it really sort of isolated some people from engaging and socializing in the ways that were an important part of their lives. And those programs and services are working really hard to gain that trust back of people, so that they can provide the services and provide that support that is needed within our community. Great. And is there another slide, or is it over? We don't know. Oh yeah, I think I actually went through all of these things. And I think we're out of time.
Yes.
So there you go. Thank you, Masicho.
Thank you.